Hi, my name is Samantha Hawkins and I am a master's student here at USM. Today I will be doing a nutrition-focused physical exam on my 22-year-old patient named Mary Catherine. So today what we're going to do first is I'm going to wash my hands, apply my gloves, and my mask. The patient has already been temp checked and has on a mask and has already washed her hands. So first what I'm going to do is I'm going to take off everything on my wrist area, along with my rings. And then take the soap, scrub, Okay, so now I'm going to dry my hands so I can properly put on my gloves. Okay. Put on back on my watch. And I'm going to keep my rings off and my scrunchie just because it's easier to put on the gloves that way. So usually the gloves are kind of tough to get on right after you wash your hands. So maybe waiting a few minutes is better, but I don't want to keep my patient waiting. Okay, so now I'm going to put on my mask, make sure the nose, and let's go grab our patient. Hello, Mary Catherine, how are you?
Hey, doing good.
My name is Samantha Hawkins, and I'm going to be your registered dietitian today. How are you doing today?
Doing pretty good.
Awesome. So tell me a little bit about your diet.
So, I drink a lot of water. I don't really like any other kind of drinks, just water. And then I usually just eat a bunch of vegetables and meats. I'm not really a big snacker or anything.
Okay, awesome. So I see you've come in today. So what we're going to start with is we're going to have a nutrition-based physical exam. Are you okay with that? Okay, so if you don't mind just signing this paper right here and we can go ahead and get started. Okay, so the first thing we're going to start with is I'm going to check out your hair. What I'm looking for here is going to be dullness and brittleness. And the reason we're checking this out is usually the dullness and brittleness can indicate a protein energy deficiency. So if you don't mind, okay. So your hair is looking good there. Awesome. So the next thing I'm going to do is check out your orbital area. Do you mind if I touch right here?
I don't mind.
Okay. Okay, so here I'm looking for subcutaneous fat loss, and I'm looking for it to be kind of concaved. Yours seem really good, so that's great. So now I'm going to check out your eyes. So what we're going to look for here is some more under eye circles and red vessels kind of around your eye. What this is kind of going to indicate is, again, the protein energy deficiency. Do you have any irritation in your eyes usually, or are you usually pretty good?
Sometimes I do because I have allergies, usually
Okay.
whenever I'm around dogs or cats.
Okay, so are you suffering from some allergies right now?
I am.
Okay. So I'll definitely keep that in mind. Awesome. Perfect. Now, if you don't mind to put down your mask for just a moment, I'm going to check out your lips, your cheeks, and your tongue, along with your teeth and gums. So, do you have any swelling or redness in your lips right now, or you feel like it? Awesome. Okay, what this can usually indicate would be a niacin or riboflavin deficiency, but yours seems to look good. Okay, so now I'm going to check out your cheeks for any type of hyperpigmentation. This hyperpigmentation is again going to be a niacin deficiency, but yours seems to look good. Do you mind sticking out your tongue for me? Say ah. Okay, you can put it back. Okay, so what I was looking for there are going to be some sores. So I don't really see any sores on yours, so you're doing good there. But usually if you have a sore on your tongue, that's going to usually indicate either a folate, riboflavin, or niacin deficiency. Do you mind smiling for me so I can check out your teeth? Awesome. And will you lift up so I can see your gums? Perfect. Thank you. Okay. So the teeth I checked for was going to be some eroding enamel, which if you had any issues with that, we would talk about later. But you're good there. And then the gums, usually if the gums are red and swollen, that's usually going to be you either irritated them or you have a vitamin C deficiency, but you look good there. Okay, do you mind if I check your thyroid and you can put your mask back on? Okay. So I am feeling a little bit of swelling with your thyroid. Do you think that could be potentially related to your allergies? Do you think
yeah, that usually happens. It swells a little whenever my allergies get bad.
Okay. Usually when it is not related to allergies, that's going to mean that you have an iodine deficiency. So as I've, started this exam, I've been noticing your skin color. That is another one of the findings for the exam. And usually what we look for is the skin to be flushed or yellow. So the flush is going to mean that you have a nicotinic acid excess. So you look good there, and then you don't look yellow as well. But the yellow is going to mean you have a beta-carotene excess, but you look good there. Okay, do you mind if I see your nails? Perfect. Okay. So what we're looking for in the nails is going to be brittleness, and usually what brittleness means is a protein deficiency, but you look good there. Okay, so now we're going to go into the gastrointestinal checking. I'm not going to make you lift up your shirt or anything today, but I do have a couple questions. Are you suffering from any type of diarrhea right now?
No.
Okay, what about a loss of appetite?
No.
Okay, perfect. So usually what this could mean is that you have a vitamin B12 deficiency or a folate deficiency, but you look good there. You mind standing up for a moment? Perfect. I'm going to check out your collarbone area. And I'm going to, if you don't mind turning around, check out your scapular area. And what this is basically checking for is I'm checking for muscle wasting. But you seem to look very active. Do you usually work out?
I do.
Awesome. Great. Great for, your cardiovascular health. And looking great there. So the last thing I'm going to do is going to check your lower extremities. So here I'm looking for... So here I'm looking for any type of edema or any type of muscle wasting here, but you seem to look good there. Okay, awesome. Okay, so now that we've completed your exam, we're going to talk about a few things. So the only thing I really did notice was the, inflammation in your thyroid area. But again, you said that's allergies, so we shouldn't have a problem there. But everything else looks great. Do you have any questions for me?
Nope, I don't.
Okay, awesome. Well, it was so nice to meet you.
Nice to meet you.
You can go ahead and check out at the front desk. I can take you.
Thank you.
Okay, so my patient has already left and has completed her exam and appointment today. So I just want to talk a little bit about it. So today I had mentioned something, whenever I was looking at her teeth and was looking for the eroding of the enamel. I didn't want to actually say anything to the patient unless it was an issue. And I would do that in a more individualized way. But basically, what the eroding of the enamel means is that they are suffering from bulimia. So I wasn't going to straight up, if the patient had that, which this patient did not have that, I wouldn't just in the exam be like, okay, that means bulimia. So I would definitely, build that relationship a little bit more with the patient, kind of realize what's going on, and kind of work with them in a very subtle way and kind of move into that to really start to work on that issue.